I started in laser surgery in about 1988, I guess it would be. I've had my medical degree since 1978. There was an opportunity on the West Coast. No one was really doing laser surgery on the West Coast, so I moved in 1992 and opened Arbutus Laser Center at that time. Well, laser surgery really caught my interest in the late 80s. I guess I've always been interested in technology. I'm kind of a technocrat. I enjoy procedures, I enjoy technology, I enjoy different devices. And I found that really lasers, like other devices, are a tool, and we can do specific things with lasers that we can't do with other modalities. Back when I first started, the laser that really attracted my attention was one that was used for vascular birthmarks or port wine stains. And really there was no other acceptable tool at that time. The other types of procedures that were used caused scars and caused adverse effects. It's still helping patients, but not as much as the more modern machines did. I think what makes our clinic unique is that we offer probably one of the widest variety of technologies for all different types of condition. So I'm not just here to treat the most popular things. I don't just treat tattoos, I don't just treat spider veins, and I don't just do Botox or fillers. There are some more rare conditions, and there are technologies that are both expensive and may not be used in the mainstream as much as others. Because of my love for the technologies and the treatments they're able to provide, I try to obtain as many of these as possible. Both from vascular lesions like the birthmarks, spider veins, other vascular lesions on the face and elsewhere on the body, and tattoo removal has steadily, I think, increased popularity, both getting tattoos and having them removed. Right. We live in an age of evolving technology. We'll see somebody for a problem 15 or 20 years ago, and they've come back because we've evolved in our technology. Now we can treat things that we couldn't then. I haven't done a count lately, but I'm sure I have about 18 or 20 different lasers and other devices. Not just lasers, it's not just lasers. There are other types of technologies that are laser-like. The conditions we can treat, there's easily 20 or 30 different types of conditions. Some are very rare and minor, and others are more mainstream and common. I think a personal relationship with our patients is very important. I try not to lose contact with my patients, even though some of the conditions that we treat are treated by one of my technicians and others in the field. I still try to maintain contact with the patients. I think that's important. They need a sounding board. They need somebody to connect with. When we evaluate a patient, it's not so much what treatment we offer, is what options we offer. And so even though a patient may come in and say, well, my friend had this done, can you do this to me? And I'll say, yes, we can, but maybe this might work better for you. So it's nice having the choices.